Good morning, Guam and beyond. Facebook Live. Good morning, KUAM TV. Good morning on you. Thank you for joining us for another episode of The Link. This Tuesday, January 25th episode of The Link is brought to you by Pacific Points, Cabo Enterprises, Tinian, and Jack in the Box. Coming up, we'll look at our 8 o'clock news. A little bit later, as we've got Rear Admiral Benjamin Nicholson, who is signing into the KUAM News Link Zoom room in just a few moments. We're also joined here from the KUAM News team. We have Nestor Lecanto, who covers military, regional. He covers just about everything for the KUAM News team. We also got Tomas Maglotnia, our regional correspondent with all things CNMI. Joe Sir on the ones and twos. We have Jason Solis from the KUAM News team, and my name is Chris. Thank you so much for joining us. Let's go ahead and get right into it with Rear Admiral Benjamin Nicholson in the KUAM News Link Zoom room. Good morning, Rear Admiral.
Good morning, Chris and Jason. Hafaday. Thanks for the opportunity to do this again on the link. I think the last time we spoke was in late October, but before we get into our discussion, I'd like to just take a second to send my deepest sympathies to Sabrina and her family during this difficult time. We pray that they may find peace and look forward to having Sabrina back in the studio soon.
Thank you so much for that, Admiral. Yeah, she's slated to return this week, and I'll be sure to pass along your message to her, but really appreciate that. And thank you again for joining us.
Thank you.
You're right. We haven't spoke since October, and I want to say a few things have happened since then.
Sure.
So we're definitely glad you can join us. And I want to turn it over to Nestor. I know he's got some kind of like nationally tinged questions for you. And then we've also got Tomas Maglotnia here, who is our regional CNMI correspondent. I know he wants to ask you about some issues going on in the NMI. And then I've got some local questions. We'll go ahead and start with Nestor Lecanto. Sir, Nestor, are you there?
Yeah. Hi, Chris. Good morning, Admiral. Nice to talk to you.
Good morning. Nice to see you.
I wanted to just start off with some breaking news. We heard out of the Pentagon just a couple of hours ago, I believe, that they're placing 8,500 troops on high readiness in case the NATO wants to call them up in response to what's happening in Ukraine with the Russians. I'm wondering if you could just give us a quick comment on that.
Well, unfortunately, that's outside the area that I really focus on, so I don't have any details on that specifically. I will say it's not uncommon for when there are different crises and world events to happen for the Pentagon to alert particular troops and to bring them up to a higher state of readiness. So, but I'm sorry, I don't have any specifics on that right now.
Sure, understand. You are the highest leader on Guam for the Indo-Pacific Command, though. So I wanted to ask you about your reaction to North Korean missile launches recently. Is this just saber rattling by Pyongyang? Should we take this seriously?
Well, I think it's important for us to take any potential threats seriously. That being said, the missiles that were launched, especially the ones here in January, and there were 4 launches, none of them posed a threat to Guam, CNMI, or the region. And we look at that very closely. As you know, we have some defensive systems, but those were not necessary for those particular missile launches. Whether it is saber rattling on the part of the North Korean or something else, I couldn't say. My focus is to make sure that we're prepared in the event of any sort of threats to the region.
And speaking of preparation, I think you wanted to talk a little bit about the missile defense systems for Guam. I know the Pentagon is spending a great amount of money to build those up. Can you tell us a little bit more about those?
Yeah, absolutely, and I'm glad that you asked about that. So for a number of years, the Indo-Pacific Command has been telling everyone and really stumping the point that we need a good missile defense system here in Guam, and that's absolutely true. But what's really happened recently, and I think this is very exciting, is in December when the National Defense Authorization Act was signed, there was $272 million of developmental money that is put towards the defense of Guam system. This is really the first large amount of money that has been put towards doing this in quite some time. There's been some smaller amounts in the past, So even though something's aspirational, even though something's needed or wanted, it really isn't until you start to see the funding come that you can really make progress. And so what we've seen is the Missile Defense Agency, who's been given the lead task here, they've come out late last year to do some initial surveys. And in fact, we have a team that's out here now surveying some sites. What I want to make clear, though, is we have a missile defense system here now, and it's somewhat limited that we have. What we're looking towards this Missile Defense Agency system is a more comprehensive integrated air and missile defense system that would cover the entire island 360 degrees. Now, the actual system that would be installed hasn't been decided upon yet. There's a couple of different technologies that are being looked at, and it may be one or the other or a combination of the two. But the thing that I want to be very careful when we talk about this is to make sure everyone understands that unlike the current system that we have that is located in one place, because the new system will defend the entire island and reach out to other parts of the region as well, too, it's going to actually have parts and pieces in multiple locations. And so what we're really focused on with the Missile Defense Agency as they're here is looking at the existing Department of Defense lands and seeing, can we make all of the parts and pieces needed to make the system work fit on the lands that DoD currently has in possession. What it's going to mean is, as we look at the lands, that sometimes some of the lands that maybe a year or two ago we thought were not needed or were in excess but had not yet been returned, we might actually need to use some of those lands for this missile defense system. Now, I'm just saying that right now because we haven't done all of the studies. There's a lot of work to be done to figure all this out and figure out the parts and pieces. But later on this year, if the Missile Defense Agency has not yet figured out exactly where the system's going to be and where it's going to go, when we publish our listing of the DoD defense lands in Guam, some of the lands that maybe last year were listed as excess probably won't be listed as excess anymore, just to give us the time for the Missile Defense Agency to do what they need to do to figure out, would we need this particular plot of land or not for the defense system.
Okay, speaking of the land, I think Chris is going to ask you some questions about that a little bit later, so I'll save that for him. Well, I wanted to also ask you about China. I know that late last year, Indo-Pac Command, and I think you were part of that, made a briefing for the senators and the governor about the Chinese threat and what would happen if Guam, if they were to attack Taiwan. Guam remains a very prime target. Can you discuss that further?
Well, certainly. So first of all, I think it's very important that we're able to share information with our elected leaders here. And so often we're able to brief Congressman San Nicolas, and often we're able to brief the governor on particular things. But this was the first time in quite some time we were able to bring this down to a more local level. And I thought it was a really great engagement to get that information out at the mayoral level so folks understood some of what was going on. So I applaud that effort, and we're going to look to try to do that on somewhat of a frequent basis to try to get everybody involved in that. But to your larger point, anytime anything happens here in the Pacific region, generally when it comes to the Department of Defense, Guam plays some sort of a role. And whether it is this as a transitory point or a logistics hub or anything that goes on at all, Guam is going to play a role. So it doesn't matter if it's China or some other actor in the region that does something, Guam will have some sort of role in it militarily. And so if there were to be some sort of action by China, then we would have some part to play in that, whatever that might be. And we do that not just for military operations or what we would consider strictly military operations, but we see that when it comes to anything we do, when it's support for disaster relief or anything else. Guam is such a strategic location just because of where it's located and our facilities here that we can do many things from Guam.
Yeah, speaking of Guam as a role, we are opening the first Marine base in 70 years. I think that says a lot about Guam's strategic role. Also, you know, China continues to try to push its borders further east and toward our direction. Talk about that growing role of Guam strategically, as you mentioned. with respect to what China has been trying to do for a number of years now, trying to keep pushing those borders further east.
Sure, I appreciate that. So actually, it's quite interesting when you look at the history here. Our military presence on Guam, actually during the height of the Cold War, was significantly more than we have here. And then at the end of the Cold War, we saw that draw down, and we had quite a small number of military here on Guam. As China has ramped up and become really the pacing threat in the region, we've seen the need to increase the military presence on here. It's always prudent if you have someone that maybe doesn't have quite the same ideals and values as you do, and you see them become aggressive or expansionist in a particular area, that you respond accordingly and you build up your forces in the area. And so that's what's been going on. And as we've built up here, not just the Marines, but we've seen an increase in our submarine presence here in Guam and some other units. But the Marines are going to be really the largest footprint that we've seen in quite some time come here to bolster the numbers. But even that being said, those numbers will still be significantly less than what was here at the height of the Cold War. It does give us more options to have the Marines here, the ability to push them out quickly to other areas. And then, quite frankly, Guam is a part of our homeland. And so we take it especially to heart that, this is an area that we defend, Guam, CNMI, and we have some agreements with some of the other compact nations as well. But it's very important that we defend this region.
Okay, I've got my colleague Tomas standing by a little bit later to talk about CNMI, but I have a couple of more questions about
Sure.
the Marine base. Where are we as far as Marine Corps base camp laws? How far along are we? Are we going to see our first troops in 23 or 24?
Well, it really depends on the progress. We would like to see some folks coming in, and the numbers have been incrementally growing right now. We're still heavily into the construction phase, and so it's going to be quite some time, a few years, until we actually start seeing the Marines wholesale come here. What we are seeing, though, however, is, and this year is seeing a growth as well, the numbers of civilian positions at the Marine Corps base, those jobs are on USA Jobs and posted for people to apply to. So what we have to do, just like anywhere else, if you were building a neighborhood, before the residents of the neighborhood move in, you have to build the neighborhood, then you have to establish the services in the neighborhood and all that kind of stuff. And that's kind of where we are right now. So as we build the neighborhood, or the base in this case, and then we start to establish the services that will support that base, we're hiring more and more people to be able to do that. So we can get to the point where in a few years, we're going to see the Marines wholesale moving here in larger numbers to occupy that base and then operate from here.
I did want to go back to the role of the Marines, and I remember a NDAA hearing before Congress, and the Marine commandant at the time, one of the questions that was asked about him, one of the concerns that was raised was the fact that even though Guam is one of the furthest west points of the U.S., there was concern that if a shooting war broke out, that there was a lack of airlift here to take the Marines to where they needed to go. Is that still the case, or is that still a concern?
Well, so the airlift that would move those Marines, and it's not just airlift, it would also be potentially surface vessels to different areas. That doesn't necessarily have to be permanently here in Guam. That stuff will come from other bases very rapidly and then be able to move the forces from Guam to wherever we need to press them out to. But it doesn't necessarily have to be here specifically to do that. And
hence, that's some of them will have that rotational nature.
So the Marines themselves, there will be a portion of the Marines that are here, and they're a permanent party, and then there'll be another portion, a very large portion of Marines that are what we call unit deployables. So they're actually based permanently somewhere else, and they will come here for 6-month rotations as they would deploying somewhere else. But they will come here, they will train in the area, and they'll be at a high level of readiness to be able to be quickly pushed wherever it happens to be that there may be a crisis that they need to respond to. And again, that's not just necessarily a military action. It could be some sort of humanitarian assistance or disaster relief or anything like that. We get a great capability about having those forces here.
Yeah, going back to what you said earlier about preparing for the arrival of the Marines, I think one of the things that the military is always focused on is the quality of life of troops when they are at an installation. So what has the JRMC done in terms of preparing for that?
That's a great question. So we're doing a number of different things along lines. So number one, when I talked about that some of the Marines would be here as permanent party, we're in the process of building some new family housing. So that's going to be a big one there. There will eventually be a new exchange on Guam for shopping. There will be some morale, welfare, and recreation facilities. We're looking at expanding some of the commissaries. So there's a whole host of things that we'll be able to do. I do think one of the good things that once we start down the path and we really see what this looks like, there's a great opportunity here, just as we do for units that come in visiting ships and whatnot, where there are tours to different parts of the island. There will be the ability to do that because every 6 months there'll be a fresh new set of Marines that are here. And in addition to the training and the things that they're going to do, they're going to want to go into town and enjoy Tumon. They're going to want to go see some of the landmarks and the sites here in Guam as well too. So I think there's although on a smaller basis, there's a little bit of tourism industry that'll take place just from the folks coming here. So I see that as a pretty good thing as well.
Yeah, I think the local business community is seeing that as a big boost to the economy, and can't wait for them to get here. I've got one more question before I hand you over to Tomas. Did you have any teams playing in the NFL playoffs this weekend, and did they win?
No, actually, I wasn't following too much. I'll be quite honest with you. As a young child, my team was the Houston Oilers, and when they left Houston, it kind of broke my heart. So I don't really follow football maybe as much as I maybe would have in the past. So really just watching to see that there's some good games, but not pulling for any one team over another.
Yeah, there were some fantastic games this weekend. Thank you, Admiral. Pleasure, as always, to talk with you. Let me pass you on to Tomas. Tomas?
Thank you.
All right, Nestor, thanks so much. Hi, Admiral. Just wanted to ask you about some recent updates and activities over in the CNMI. I know you were just over on Tinian for the reopening of Chigat Beach. Can you tell us what are some of the latest activities that are happening on Tinian with regards to Joint Region Marianas?
Sure, I appreciate that. And the Chigat Beach reopening was fantastic and really a great project that we were able to do there in remediating that place that had used to be at one time a battleground and then a mortar range. But then able to open that back up was really fantastic. And we're hoping to do some more things. But for Tinian specifically, there's a number of things going on. We're working on a number of different projects. One is we have some harbor improvement projects where we are improving the port and the ability to take ships into the port. So there's a number of things that are ongoing there. We're also looking at the ability to improve the airport there. Improve some of the taxiways and aprons there and even some of the fuel storage. So there's a number of things that are happening there. And then we're always looking at in the northern portion of the island in the military lease area there, how we would use that as a austere training environment. So not looking at really developing that area as much as just using that area without disturbing it as much as possible. But the other big news that we're really looking at hard when we had our last stakeholders meeting with the CNMI was we are really working hard towards getting a landfill site in Tinian that would be used by the local community and by military that would be operating there. So that's really exciting. There's a number of steps that have to happen for all of these different things, but we've got quite a bit that's going on there. So we're just excited to continue to work with the folks in Tinian and the government and CNMI to move these projects along.
And some of the information received from the CNMI Bureau of Military Affairs, they said they had about 55 meetings with DOD, of course not all of them probably with you, but that's the first we're hearing of the landfill. Do you mind providing more details where exactly that's happening and what conversations you've had with Mayor Aldan or the CNMI Governor Torres or the CNMI Bureau of Military Affairs?
Sure. So we had a stakeholders meeting late last year, and it brings together all the different folks. And this is actually something that has been going on over a number of years where the people in Tinian were looking for a place to do a landfill there. At the same time, the military, when we operate in Tinian, we have to haul all of the trash off of the island. So there was some work that had been done a number of years ago to try to find a place, and there was some back and forth, and it didn't really work out. And so there was a new proposal that had come up from the mayor there and the team in Tinian. But we looked at that together, and we're really looking now hard at an area that's on the military lease, so it really doesn't take away from any other existing areas that we can potentially put this landfill. There's a lot of work still to be done. We have our environmental team looking at this. We're working hard with the people in Tinian and CNMI to figure out where this goes. But I'm very confident that we're going to be able to come to an agreement on where we can put this and how it would be operated and all of the parts and pieces. So we're really at the initial stages here, but I'm just really happy because I think that at this point, we've gotten everybody to agree that this is really the right way to go and the right path that we're pursuing. So I'm very excited about where this is going. And I'm sorry I don't have a much firmer outlook on this for you right now. We've still got some work to do, but I think in the coming months, we'll start to solidify this, and hopefully we can move forward very quickly.
And Admiral, just before passing it on to Chris, I wanted to ask you about the Mariana Islands Training and Testing program. We know that in August 2020, the Department of Navy announced its decision to implement Alternative 2. That's to continue training and testing within the Mariana Islands Training and Testing area. What has happened since then, since August 2020, when this announcement was made?
Sure. So basically what it is, and you've seen some of this already, I think, is we've seen in the last couple of years here a pretty significant increase in the amount of training that goes on in the region. And that's for a number of different reasons. I think in the big scheme, as we the military focus more and more on the Pacific, more and more on the region, we're going to see some more exercises here because it's really good when we do training that's in the environment, in the area where we might have to do some operations. So in that area, and what we call the Mariana Islands Range Complex, which encompasses part of that as well, too. We're seeing a number of different training events. So most of those happen in the air. In fact, we have a big exercise that's just kicking off right now. A lot of them happen at sea, which you'll not see directly because the ships will be away from the land and you won't see the exercise go on. Some of the things happen under the sea with our submarines. And then we do have some land events as well, as we saw last summer. So there's a number of different things. So really what it means is that we're going to continue the training in that area. But it also means that we have the responsibility to ensure environmental compliance. And so my team here at Joint Region Marianas, I have a team in the Mariana Islands Range Complex, the folks that run that, along with our environmental team. They look very hard at all of the training requests. We work with the local governments to ensure that whatever training we're going to do is in compliance with the environmental laws. So that's the main point there.
And with regards to Pagan, I know this coming out of the Bureau of Military Affairs, they conducted their own 1-month field characterization survey. Are you privy to any information in terms of the developments over in Pagan and potential use of Pagan?
So not specifically to that latest survey, but Pagan is one of the areas that we've been potentially looking at as another training area. So as we look at all of the different islands in this region, each one provides something a little unique and different. And we're looking at what is the best way that we can train our forces and, preserve the environment and preserve the culture and these sort of things. So we're looking at a number of different things. So Pagan is one of the things that have been looked at as a potential area, but we still have a lot more to do to study if that would really work out or not.
All right, Admiral, thanks so much.
All right, thank you, Tomas.
Thank you.
Rear Admiral Chris here. I want to start on COVID because I know that Public Health they had a press conference. I want to say it was last week or the week before, but they had kind of mentioned a significant portion of the positive cases reported had come out of DOD, and I know last night of the 662 cases, I believe 150 were reported from the Department of Defense, and so we don't get much info out of DOD, obviously. But so who are these people? Where are the cases, and just I guess the status of how DOD and JRM are dealing with this Omicron surge?
Sure. No, I appreciate the question. So the numbers as of last night, when we just talk about number of infected cases, the overall for Guam was 7,050, and the overall for DOD was 739. So DOD was about 10%. But I want to be very clear, because I think this can get a little confusing sometimes. When we say DOD, when we report the numbers of DOD, we're not just talking about our active duty force. We're talking about our active duty force from our services, plus the Coast Guard, plus we're talking about the family members of those active duty members. We're talking about our DOD civilians and their family members. We're talking about contractors. We're talking about the Guard, and we're talking about retirees. So our classification of what we report from DOD is actually a very wide scope of people. So we just have to be very careful when we're comparing numbers and percentages to try to say, well, how much was DOD or how much? So I want to try to stay away from that. What we are seeing, however, is similar to what overall is happening in Guam. We're seeing a surge in what we believe is the Omicron variant here in cases. Now, for the members that we're seeing, over more than half of the infections in DOD are not active duty service members. A lot of it are their family members. A lot of it, some of the civilian contractors that work for us. But never mind that. The good news is very, very small hospitalizations. And so most of the cases we're seeing are very mild. We are very lucky that we have a large number of our population that's not only fully vaccinated, but we also have a number of folks that have their boosters. And what we're seeing is, although we have a large number of cases, and many of those cases are figured out through contact tracing with people that have no symptoms whatsoever, but we'll go through the steps with them as well. But really, it's not having much of an impact on us. And in fact, we are looking at how we fight through these sort of things and continue operations without bringing us to a complete halt. So gone are the days of a ship not getting underway because it had maybe one case on board. We're fighting through these things. We're learning how to operate with this. So I think that's a very good news story when it comes to how the Department of Defense overall is looking at this. Now, obviously, we don't want anyone to be sick, and we would like to have measures in place to not do that. The other part that we're seeing here is, and we saw this play out earlier or later last year as well, too, through these surges, we've generally seen the surge in DOD sort of be a leading indicator towards the surge of the overall Guam population. Number of different reasons for that. You know, potentially it's the fact that we operate sometimes in very close quarters. You think about a ship or a submarine and how closely packed those sailors are together, so things can spread very easily. It also, we have a number of people that for a number of different reasons, whether it's the holidays or meetings or whatever, will travel back to the continental United States and come back where, you know, we've seen some cases there. So we've generally seen the DOD numbers will start to rise first, and then we'll see the overall population numbers in Guam rise first. And then on the backside, we'll see the DOD numbers start to come down and the overall population numbers in Guam come down too. So we've seen a downturn over the last 24 hours in the infections in DOD. I'm hopeful that trend will continue, and we'll just see how this plays out.
Rear Admiral, so I know there's a bunch of military exercises coming up. What's the testing protocol for military members who are in these trainings and on Guam for them?
Yeah, that's a great question. So the interesting thing is, especially the exercise that we've got going on right now, Cope North, that is a multinational exercise. So what we do is we apply the different rules and regulations, a combination of the Centers for Disease Control, a combination of local Guam regulations, and a combination of DOD regulations to try to come up with the best mix to be able to appropriately screen people coming in. So in the case of the big air exercise, Cope North, that's going on right now, we have the United States plus about 4 other nations that are participating in that. So what's been put in place, and this is mostly being run out of Anderson Air Force Base because that's where the exercise has taken place from. They have a regimen of testing, both when people arrive and a whole sort of different things. Bottom line is they're doing everything they possibly can to ensure that, number one, that nobody brings anything in, Number two, that if someone were to bring something in, or we start to see a cluster somewhere, we were able to quickly isolate and contain that so it doesn't spread to the larger community, both within the exercise and into the larger population. Number of other things been put in place. Yes, there's a number of those service members that are staying in some of our hotels out in town, and there's some pretty strict regulations on where they can go, where they can't go, and some time limits that go along with that as well too. So there's a number of different things that have been put in place. I think we have a pretty good plan to ensure the health and safety of not only the exercise participants, but also here the people of Guam.
Rear Admiral, Public Health locally had announced last night that they're now prioritizing testing for symptomatic patients and high-risk close contacts, and they're saying it's because of a shortage of supplies like test kits. Is JRM facing a similar issue? And has it affected your testing protocols?
Yeah, so no, I appreciate that question. So I believe that there's in the United States, there's a shortage writ large on the test kits. We've seen that play out in a number of different places, not just here in Guam. And so we're taking some similar steps. In fact, we're doing quite a bit of, people that are sick, stay home, go through that thing. But right now, not an overall shortage of kits, but that could change very quickly.
I wanted to also get in on this billion-dollar healthcare complex that the governor is proposing to build at the Eagles Field area, Backward Anderson. Could we just start with just a status update on what is the status of those properties right now?
Yeah, so the property in question, that area in question, and this goes back to some of the comments I made earlier. Last year on the land disposition list for DOD, that area was listed as excess. Now, just because an area is listed as excess, it doesn't mean that it's automatically returned to the government of Guam. It means that at the time that the list was written, there were no plans for that area. What I discussed earlier in the conversation about the Missile Defense Agency, that is one of the areas that's being looked at as a potential site for a portion of the missile defense system. So when we update our list, and it generally comes out in March, when we update our land disposition list, it is highly likely that will be no longer listed as an excess area because we need to take a look at that very carefully to see if it is one of the sites we need to use for the missile defense system here in Guam. Now, that being said, previous to the Missile Defense Agency getting the money and going through the process that we're in right now, previously, we had looked at that land and there was no significant specific DOD-only use for that land. So in the past, there were some negotiations that were undertaken at very high levels to look at, is it a possibility that something could be put there that the government of Guam could use it? So there was an idea of a hospital complex, and very intriguing to a number of different people. Obviously, to the folks here in the region, having a new and updated hospital complex is pretty good. But also, the Department of Defense would look at that as also a way that we would be able to expand some capabilities. So the idea at the time was, if a hospital was built on that location, that there would be stipulations that it would have some specific capabilities that would add to the ability for the Department of Defense to use those facilities and that medical stuff, which is what led to a process of proposing a lease of the property there, which would give the Department of Defense the ability to stipulate particular items be built into the hospital as part of that lease. And so that's what's been going on. And then we're going to have to see really how this is going to play out now, because at the time all of those decisions were made, the missile defense system was something that was aspirational. It really didn't have the teeth to it because it didn't have the money behind it. Now that we have the money, now that we're exploring the sites, it could be that site is really prime real estate and absolutely necessary for the missile defense system, in which case maybe the hospital wouldn't be built there. It would have to go somewhere else. So that's kind of where we are, and hopefully that explains where we are right now. So there's a lot of things that are up in the air. Any negotiations at this point are really at the beginning stages. Again, I know the government of Guam is looking at that area for a potential hospital complex. I know the Missile Defense Agency is looking at that area as well. for a potential site for missile defense.
Rear Admiral, so can you just confirm, was there a license signed between the government of Guam and Joint Region or any DoD entity for the properties up there to be able to build a new hospital complex?
So there's no license to actually build a complex. There was license to explore if it was a good location. So just as we're letting the Missile Defense Agency look at that area to see if it would be good for missile defense, we're allowing the government of Guam to look at that area to see if it would be potentially good for a hospital. So there's no agreements right now to actually build anything or actually lease the land or any of that kind of stuff. Right now, this is just all exploratory because no final decisions have been made at all on what would happen with that land.
Wow, because I've read most of the correspondence between the governor and the Navy Secretary, and it kind of seemed like things were barreling down towards, we're going to give you a lease for 50 years and you're going to be able to build this. So that's not accurate at all anymore.
Well, I think the thing to keep in mind here is, again, and this is where the situation has somewhat changed with the missile defense system coming here to Guam. If we absolutely need that land because it's the only place that the system a portion of the system will work. And quite honestly, that land that we're talking about, when you look at where it is, north-south wise, it's very central in the island. East-west wise, it's more towards the east, which the DoD doesn't have a lot of properties on the eastern portion of the island. It's on some higher ground. So all of those things make it very attractive for a missile defense system. So I think we need to slow down a little bit. We need to let the evaluations play out before there's any permanent decisions made on what we would do with that particular parcel of land.
Rear Admiral, are you able to give us any more details? And you said that earlier in the discussion that if the government of Guam was to build this $1 billion healthcare complex, that there were certain stipulations and I guess things that you guys would want built into it to kind of be able to meet DoD JRM demands. Are you able to elaborate on what some of those were?
I can give you a couple of things that were being looked at. So that land, as it is right now, we often talk a bit about Eagles Field and where the sports area there is. There's also a current existing weather radar that the DoD operates that's on that land. In its current position, even though it's up on a tower, it has a blockage zone because of some high-rise buildings to the west. So, for example, one of the stipulations being explored was if a multi-story structure were built there, just as we see in other large cities, the potential to put the radar on top of the building to be able to decrease the blockage zone and have the weather radar work to a longer range. So that's one example. Another example I could give you is, although we have a helicopter pad at the Naval Hospital, at the time that that helicopter pad was built, it was not built to be able to handle the high heat of the MV22 Osprey aircraft that the Marine Corps operates, and now the Navy operates a version as well to supply the carriers. So the ability to land directly at the Naval Hospital with that particular platform, which is strictly a military platform, we would like to be able to put that into any new complex that was built. So if there were a service member that were injured and they were being able to be transported by one of those aircraft, they could fly directly to the hospital. So it's things like that. And there's a number of other ones too, but those are two very visible things that I could talk about were things that were being explored as potential things to be put into any sort of the plans.
Wow, Rear Admiral. I mean, we have, and I think part of it is that we've only been able to kind of get one side of the conversation on the GovGuam end and maybe glean information from letters that we received that were written by the Navy Secretary through Freedom of Information Act request. But I mean, this is huge new information that you're telling us this morning. So I definitely appreciate that. I did have one more issue I wanted to touch on, and it's, go ahead. Did you have something?
Yeah, just so I want to also, when we talk about this, the idea of a health complex is something that's of mutual aid. It's good for everyone. And so, I talked about the MV22 Osprey, which is the tilt rotor aircraft that can land like a helicopter, but it has the range of an aircraft. So think about this. With an Osprey, if we had a sick or an injured patient, whether it was DOD or whether it was a local civilian, let's say up in one of the northern islands of the CNMI, that's out of the range of our current helicopters. But with an Osprey, that's within the range where you could go to a location, and even if they didn't have an airfield there, that Osprey would be able to potentially pick up a patient and then bring them directly back to the medical complex. So it's the ability to put together the needs of the civilian community in the region, along with some very DoD-specific abilities, and marry those together, which makes that a great thing when we're looking at how we do this. And I appreciate what you've been doing and what you've been saying. You've been looking at some of these official records, but there's a lot of discussion that goes on outside of that we're looking at a number of different things. And so I'm glad that I was able to kind of hopefully enlighten you on that process.
Thank you. Just, I guess, one more on this issue. Are there any other properties in your inventory that have been entered in this discussion as possible alternatives to the property the governor had been looking at?
Well, I think what we're going to have to do now is, because of the extensive research that the Missile Defense Agency has to do, we need to let that play out first. And I want to also clarify, when we look at properties and we say where things need to go, when we're talking about a missile defense system, it is not just you need a piece of land to put something on. That land has to be in a location where, when we're operating radars or missiles or these sort of things, it doesn't interfere with other stuff. So, there are plots of land that, because of their location or because of where they are in reference to the Wonpat International Airport, they may not be good at all for a missile defense system. And then there are other parts of land that maybe. So part of the research that's going on right now by the Missile Defense Agency, they're not just going around and looking at the land. They're actually going and they're using some sophisticated gear to measure radiated signals that are already out there to make sure wherever we put the system or the pieces of the system, it doesn't interfere with anything. So I think that's kind of number one. We have to let that play out and see how this is going to be designed, where it's going to go. But once that's figured out, then we can see, are there other locations that might be a possibility for a healthcare complex that, again, both supports the regional community and Department of Defense.
Rear Admiral, sorry, just one more on this.
Sure.
What is the timeline when you talk about missile defense and they have to study? So is this like a 1 year, 2 year, 3 year?
Yeah, that's a great question. Right now, we're at the stage where we had engineers that are here doing the measurements, as I discussed. They've been here for about a week, and they have a few more days to go to finish this round of measurements. There is quite a bit that has to go into this process, because what we don't have right now is a definitive decision on what type of system is going to be put here. There's one type of system that's based on the existing technology that the Army uses. There's another type of system that's used on the existing technology that the Navy uses. There's a possibility of one or the other of those systems coming here to Guam, or potentially a combination of the two. And this is because it's a wide range of threats that we're going after. Right now, we have some pretty good capability against ballistic missiles, but what we want to have in the future is a system that can not only take on ballistic missiles, but hypersonic missiles and cruise missiles. So it's a much more wider range. So unfortunately, I don't have a really good timeline for you, because there are some decisions that have to be made along the way. Right. I'm very hopeful that a lot of this will be decided here within the next few months, or at least by the end of the year. But I can't tell you specifically what that's going to look like until we get a little farther down the road.
Would DoD fund any of these stipulations for the included in the construction of a new hospital, or would that kind of depend on where it would be?
Well, that's something that would have to be negotiated. There's a look at what could be. There are some things that could be built into the hospital that really are no change in the cost, just in the way you design it up front. And then there's some things that might need some specialized equipment. So that's going to be part of a negotiation, however this turns out to be.
Rear Admiral, last issue, open burn pits. I don't know what the status is, but I do know that there was a permit being sought with the local EPA for an open burn pit at Anderson. When we had Guam EPA on, they said that burn pits hadn't been used in a couple of decades, but what I'm hearing this morning is rumblings of possible legal action on the federal side relative to these burn pits. So could we just kind of first start on what is the status of the burn pits, and why are you guys seeking a permit to start using them again?
Yeah, so I'll tell you, that's been mostly focused on Anderson Air Force Base and the action that's going on up there. I don't have a lot of the details with me. I'd love to come back with you on that one. I will say one of the things that we use some of those sort of facilities for is to help with some of the unexploded ordnance that our explosive disposal teams are able to take out of the community or when there's construction areas. But I would rather come and circle back with you on that one because I just don't have a lot of the details with me right now.
Okay, is there anybody else? You good? Jay, did you want to jump in here? Anything about the Houston Oilers? All right,
well, the Admiral's like an old school Houston Oilers fan. Admiral, I'm sure Warren Moon, Earl Campbell, like Webster Slaughter, those guys.
Yeah, love you, Blue.
Right,
good team.
Yeah. All right, Rear Admiral, thank you for your time, and we would definitely, because like I said, I feel like there's going to be some developments with this open pit burn thing. If you could circle back at any time, just let us know, and we'll be more than happy to get you on.
Absolutely.
Thank you.
very much.
Thank you. Okay, be safe. Right on.
Thank you, sir.
Wow, huge interview there with Rear Admiral Benjamin Nicholson. Tomas, I think my jaw is on the... I don't know how my jaw is staying in this mask because I feel like it's on the floor right now.
Lots of huge developments. I mean, even out of Tinian with the landfill that they want to develop there in coordination with the local community as well. So,
and they did say that they were looking at existing property that they have that they're leasing from the CNMI.
Yes, yeah, we're gonna definitely give that a re-listen on our YouTube page after the show ends because lots of good information there.
Yeah, I mean, to me, off the bat, the biggest takeaway outside of the national stuff that Nestor just like on it, man, was this these developments, these new information with the billion dollar healthcare